Hello, my name is Joseph Brunner, and I do welcome you to this tutorial on LuSi LIFE for teachers. Today we are using the RDS case included in the sample cases shipped with LuSi. In this case, the lung collapses easily if not held open by expiratory muscle tension. If there is no muscle tension, for example in apnea, then the lungs collapse and saturation drops. So let's start this scenario, and here is what the learner sees: low saturation and tachypnea. As a trainer, you are in control of this information, so let's have a look at your control panels. First, you can determine what the learner sees. As a teacher, you can make vital signs visible or make them disappear. This way, you can create challenges for the students during the training. While your students or learners may not always have the information, you always do. But remember, you do not need to adjust any of these vital signs. They are a consequence of RDS and the treatment the learner provides, just like in the real patient. Now, in contrast to real patients, you can virtually look inside your RDS patient. First, you can look at lung mechanics. Endotracheal pressure, alveolar pressure and esophageal pressure displays are available along with real-time lung volume. In this RDS case, LuSi's lungs collapse during the apneic phases, causing desaturation. The learner only sees desaturation, but you know why it happens, because the lungs collapse during apnea. As soon as LuSi picks up breathing again, she also recruits the lungs, and saturation increases again. Second, you can virtually measure inside the patient. Open up the More Data window to see blood gases, tidal volumes, alveolar pressures, distending pressure, or even venous admixture. All this data is consistent with the vital signs the learner sees, without you having to adjust any controls, because all data is from the same patient. So LuSi does the simulation, and you do the training.